Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello and welcome to this episode of Triage. My name is Victoria Hamscho and I'm an associate in the K&L Gates Washington, D.C. office, where my practice focuses on healthcare policy and regulatory matters. In this episode of Triage, we will provide an update on key developments in the 340B program, and in particular, on a recent ruling by the U.S. Court of Appeals for the Fourth Circuit that could have important implications for the Health Resources and Services Administration's definition of a 340B eligible patient. But before we get started, I would like to welcome two of my colleagues who focus part of their practice on the 340B program regulatory and compliance matters, Andy Ruskin and Leah Richardson.
Hello there, and thank you all for joining this episode of Triage. This is Andy Ruskin, and I'm a partner in the DC office of K&L Gates.
Hi there, I'm Leah Richardson, and I'm a partner in the RTP office of K&L Gates.
Andy, on July 1st, the Fourth Circuit issued its anticipated decision in Genesis Healthcare v. Becerra. Could you tell us who the parties are and what the background of this case is?
Sure, Victoria, I'd be happy to. The parties in this case are, on the one hand, the Secretary of Health and Human Services, acting in his official capacity, and the other is a federally qualified health center, aka an FQHC, named Genesis Healthcare, which goes by the acronym of GHI, very clever, and GHI has sued HRSA, has sued the government, specifically HRSA, in order to overturn a negative finding on audit where apparently this entity had been qualifying prescriptions that had been written by physicians who were not necessarily treating patients as in their capacity as being patients of the FQHC. And said these were actually patients of the FQHC, but they were not being treated for the illness that led to the prescription. And so HRSA said that was a problem. And so they said that there would need to be a major repayment to manufacturers associated with these prescriptions in order for the FQHC to remain in the program. So the FQHC said that was way too broad of an interpretation of HRSA's authority to define patient, and they sued, and HRSA then withdrew the finding, but did not necessarily withdraw its conclusions as to who qualifies as a patient. And so as a result of the fact that the finding was withdrawn, the case was viewed as moot by the district court. The case was then appealed to the Fourth Circuit, and the Fourth Circuit then said in a decision that was issued on July 1 that, in fact, this was not moot because the guidance under which they were expecting, that HRSA was still expecting the FQHC to be operating under, was still in effect. And so as a result of that, this is now no longer moot, and it's going back to the lower court to now examine the definition of patient, the significance of which Leah will cover in just a second. Note that there was nothing in this decision about the definition of patient. It was simply a question of whether there was still a live issue. So whether or not the ability to say anyone who is registered as a patient at the FQHC is acceptable is still an open question, as is whether or not the guidance would apply to hospitals that are covered entities and not just FQHCs. And one final point, Victoria, that's worth noting is that this guidance, if it gets overturned as to the definition of patient, that Leah's going to go over in a little bit, goes beyond just how covered entities operate. It also will affect how manufacturers view HRSA's authority going forward, as this will almost certainly address that particular point as well.
Thank you, Andy. So, Leah, what are some of the implications of the Fourth Circuit's decision in this case?
As Andy mentioned, the court is remanding this case back to the district court to determine basically the authority of HRSA to issue sub-regulatory guidance related to what it means to be a patient of a covered entity under 340B and whether Genesis's interpretation of patient is reasonable. You know, the significance of properly defining patient with respect to your entity is, can't be understated. It really is the key to a 340B program, since the statute only permits dispensing 340B purchased drugs to a patient of the covered entity. So it really is key. This question is key to the whole program. In 1996, HRSA provided sub-regulatory guidance, a three-pronged patient definition, as all of our listeners will know. They've also, through the years, kind of expanded on that, kind of that basic three-pronged definition through audit, adding arguably additional qualifications on what makes a patient. For example, where the prescription was written, which was, part of Genesis's case against HRSA, is that the narrow definition that HRSA enforces is frustrating the intent of the program. And so this case has implications for what HRSA's authority actually is, and whether Genesis's interpretation is reasonable. But I think it goes beyond that. And I think that 340B entities and manufacturers are closely watching this case. Some folks might think that the district court will provide some clarity, or hoping that it'll provide some clarity with respect to patient definition. But I think the likely outcome is that this court will agree with other courts that have said that the 340B statute unfortunately does not provide HRSA the authority to regulate this program properly, including to issue guidance related to patient definition. And what that means is that we will fall back to the statute, which simply requires that 340B entities only dispense to their patients, but really doesn't provide any more guidance than that. So I'm not sure, at the end of the day, folks are going to get more clarity on what an eligible patient really means if you're just looking at the statute. I also think that, in light of the litigation that's currently occurring with respect to data sharing requirements and contract pharmacy arrangements, covered entities pushing courts to continue to hold that HRSA does not have authority to regulate the program is going to benefit manufacturers as well, arguably as well as covered entities, depending on how you look at it. I think we're seeing some broadening of the patient definition in certain instances for covered entities. If covered entities have nothing to look to with respect to what it means to be a patient of the covered entity other than the statute, I think that gives covered entities a wide berth. But, I think covered entities should keep in mind kind of the intent of the program and still being thoughtful about, when you're defining your patient definition, what nexus does that patient have with the covered entity? What nexus does the prescriber have with the covered entity in order to define what eligible patient means to any particular covered entity?
Thank you, Leah and Andy, for sharing your perspectives on the Fourth Circuit's decision in Genesis Healthcare v. Becerra. From a big picture policy perspective, I think it's important to note that this development coincides with a growing interest from the federal government in reforming the 340B program and potentially providing HRSA with such greater authority to regulate all 340B stakeholders. Any such legislative action should be closely watched by 340B stakeholders, particularly in light of a potential Republican takeover of the House and or the Senate in this year's election. Republican leaders are in the process of defining their policy priorities for the next Congress, and 340B reform could be a part of that. As listeners may be aware, Republican leaders from the House Energy and Commerce Committee and the Senate Health, Education, Labor, and Pensions Committee have long considered potential reforms to the 340B program. And most recently, in 2020, they issued a request for information regarding the program. So to the extent there is Republican control of Congress, it's possible that they may issue the feedback that they received in developing proposals to modernize the program, which could include new compliance requirements for stakeholders, as well as new authority for HRSA. We will continue to monitor these developments. Our healthcare and FDA practice and public policy and law practice regularly advise 340B stakeholders on compliance matters and facilitate stakeholder engagement with Congress and the administration in this regard. Thank you again for listening to this episode of Triage. Please contact us if you have any questions.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.